Annie. Well, thank you all for joining us. I know it's 6 o'clock. I'm just going to give another minute or so for some more of our friends to join us tonight. But thank you all for being here, for being on time. I really appreciate you. And we will get started in a couple of minutes. Hey, Tarnisha. Hey, Nina.
Hi, good evening.
Good evening.
I have a coworker today. Let me see if he'll come on.
Oh, wonderful. Oh, hi, friend.
Aw,
Gotta make sure he gets his paycheck for today. Working
That's
hard.
right.
I love that. Well, welcome. Hey, Ariel. Did I say that right?
yes, hi.
Hi, welcome. Love your name.
Thank you.
Hey, Devin.
Hello.
Hey. I almost said good morning. It's good evening. Oh, gosh. Hey, Deborah.
Please don't start the day over. Although
I
there was a
know.
repeat, it might be okay for the weather.
That's it. I don't want the day to end because of the weather, but I'm ready for the day to end because we've been working all day. So, like, yeah. Hey, Taylor.
Hi, good afternoon, everyone.
Evening, good evening. Hi, Rhea. Hey, Greg. Oh, he's not in yet.
How's it going?
Hello. Hey, Greg. How are you tonight? We'll give it another minute, and then I guess we'll start like 6:03-ish. So thank you again, everyone, for being here. Hey, Sophia. Welcome, welcome. Hey, Amber. We will get started shortly. I know it's probably dinner hour for some, so I don't mind if you need to sit and eat during the meeting. That's totally okay with me. Grab a snack, grab some water, and we'll get started very shortly. Thank you all for being here. And everyone can still see my screen, correct? Thumbs up, head nods.
Yes.
Awesome. Great, great, great. All right, let's see. Let's see. Hi, Camille. Welcome.
Hello, everyone.
Hello, good evening. All right. Why don't we go ahead and get started? I want to be respectful of everyone's time. And then, yeah, we'll go from there. So just good evening. Welcome, everyone, to our full quarterly coalition meeting. As always, we have a full agenda for you all today. Lots of updates to keep you all informed of what's going on at the health department and with the coalition. So we're looking forward to sharing those with you all today. I do want to turn it over to Dr. Stacy Little for our official welcome. So Dr. Little.
Yes, I just wanted to say welcome, everyone. It's good to see so many familiar faces, and the work of this coalition is so important. And, we're trying to advocate for the best health and well-being of our residents of Prince George's County. And many of you are in the thick of it. Some of you are doing the advocacy, and others are doing other work. But it's the collective of this group that's so important that your voices are heard around the needs of our community. And looking forward, like you are, to hear about the progress being made with the chip. So welcome all.
Thank you for that. Yes, welcome, welcome. And as you enter, if you haven't done so already, please type your name and organization in the chat so we know that you are here with us today. And as a reminder, this meeting is recorded. So I know you all have your best smiles on for today, especially with the sun outside. But we do just want to thank you again for participating today. Before we begin, I do just want to take a moment to share with everyone the coalition's vision and value statements, which I think closely align with the health department's vision that all Prince Georgians are their healthiest at every age and every stage. But the coalition envisions a place where the health and well-being of everyone who lives, works, plays, and visits the county is elevated. And we do this by creating an environment where everyone can thrive and not just survive. So to bring this vision to life, our values guide our actions. First, we aim to reduce health disparities by promoting health equity. So we're trying to make sure that everyone, regardless of their background or circumstance, has fair access to the care and resources that they need. Second, we focus on promoting the availability of quality health care throughout the county. So we want to ensure that care isn't just available. We talk about how everyone knows that most people know that this care is available, but it doesn't mean that it's accessible and even effective. So we want to make sure our efforts go towards that. And then finally, we recognize that health and well-being doesn't just happen in isolation. There's been a lot of conversation around collaboration within the coalition and outside of the coalition. And so that's why we prioritize our partnerships. So we work closely with our local organizations, our community leaders, and our community members so that together we are creating a lasting and meaningful impact in the county. So our vision sets the destination and our values help guide how we get there. So thank you again for helping us to advance our efforts. So now that we've had our welcome and briefly reviewed today's agenda, the next thing I'll do is I'll invite Olo to come and share some leadership transitions that have recently occurred at the health department. And then I will come and share some staffing updates within the coalition. We'll then have our CHIP check-in, and I'll share a bit about what we've been doing this past quarter to progress in our CHIP development process. I'll have the co-chairs come to share some updates on the efforts that the work groups have been making towards the CHIP action planning process. And then in true coalition fashion, we'll close out with some community announcements before we adjourn for the evening. So with that, I'd like to invite Olo to come and share some leadership updates. Olo?
All right, thank you. Of course, if folks know me, my name's Olo. I'm the Deputy Health Officer here at the Health Department, and I am pleased to announce that the administration has selected a new and very, very exciting person to serve as our new health officer. She started in the health officer position in just at the end of January. Her name is Dr. Toyin Opesami. And just to give you a little bit about her, she goes by Dr. O. So that's what all of us call her in the office, Dr. O. So she is an experienced family physician. She has a background in family medicine, also has specialized expertise in HIV, behavioral health, particularly addiction medicine. She's a certified buprenorphine prescriber. Dr. O got her bachelor's in science in biology from the University of Illinois at Chicago, and she earned her medical degree from the Medical College of Pennsylvania. She completed her family practice residency at the University of Texas Health Center in Tyler, Texas. And, since she's been for a long time, she's had really dedicated her career to improving the health outcomes, particularly for diverse communities, and holding a number of prominent positions in various practices. She's also one of the, I believe, one of the founding members of of our health zone many years ago, the PGC Health Zone. I want you to give a warm hand and welcome for Dr. O. And I'm sure, we're very glad to have her. She hasn't been here for very long, but she's already had to deal with at least one crisis, our weather emergency. And there's a lot of work to be done in the health department. We're really glad to have her here. I also want to, on a personal note, give an announcement about my transition. So this is actually my second to last day in the office. After a little over 5 years, I will be transitioning from my position as a deputy health officer. Tomorrow is my last day, and I just wanted to say it's really been an honor and a privilege to have served here at the health department and within the county. It definitely was a tough decision, but it was the right decision for me at this time. I am just, I was it's definitely bittersweet. I have a lot of great memories here. I started here at right in the middle of COVID, and it's just started there and just been one exciting ride ever since. But I'm always be an enthusiastic supporter of the coalition, and I'm happy that I'm leaving and the coalition has strong leadership, strong membership to keep things going, because the work it doesn't stop, and there's a lot more work to do. So thank you all, and yeah, just thank you.
Thank you, Olo. I think, if I can speak on behalf of everyone, we are so sad to see you go, but we are especially grateful for all that you have done for your staff at the health department, for your support of this coalition, and we can only respect that this is like you said, the best choice for you. So thank you, as always, for just your exceptional leadership, your guidance, your sense of humor, your positive spirit, and we just wish you the absolute best in your future endeavors. Thank you so much, Olo. And of course, we have lots of comments. Thank you for your service. Thank you, Olo. Thank you for everything you've done, Olo. Thank you, Olo. So again, the sentiment is across the board. Thank you, thank you, thank you.
Yeah. Well, we will be, rehiring on my position. So the recruitment process has already started. We're also going to be hiring on another deputy within the agency who is traditionally overseeing more of our programmatic and clinical areas. This position has been vacant since before I even started. So I've been the only deputy since in my over 5 years here. So we're going to be pushing forward, and we're going to have actually two deputies, and we're going to be able to better support the health department and all the priorities that we have.
Awesome. Thank you for that update. All right, more to come, and we move ahead, right?
Indeed.
Thank you again for all your support, Olo.
You're welcome. My pleasure.
So as you can see, the health department has had some pretty big changes, but we also want to acknowledge some staffing additions to our coalition team. With that, the coalition welcomes back our dear Miss Rhonda White-Yakub, a public health coordinator who brings over 40 years of experience in public health, everything from health planning to grant writing, implementation, administration, program development, community engagement. Miss Rhonda does it all. She earned her Master of Health Services Administration from the University of Michigan School of Public Health, and she currently oversees what many of you may be familiar with, the health department's senior survey, while also supporting the Office of Assessment and Planning with everything from quality improvement, coalition support, and health planning initiatives. So if we can give Ms. Rhonda a warm virtual welcome. Welcome back. And then we also welcome Ashton Jordan. We can call him AJ. who began his public health career with a strong focus on communication, health education, and equity. He earned his BA in health communication from Michigan State University. He has an MSPH in health education and health communication from Johns Hopkins University. And he is currently pursuing a Doctor of Public Health in Leadership and Management at Claremont Graduate University. I don't know how you sleep or when you sleep, AJ, but we're happy to have you here. Since entering the field, AJ has worked in public affairs, program planning, community engagement. He has helped to plan and promote hundreds of events that are accessible, community-driven, and that also support community engagement, health empowerment, and health equity. So AJ, we welcome you again to the coalition. And if we can just give everyone a warm virtual welcome, a hand clap, all of our new staff, and of course, a hand clap for Olo again for all of his effort with the coalition. So welcome everyone. We are glad to have a full team. I am so glad. So thank you all. All right, so moving on to our CHIP check-in. I do just want to take, just a few minutes to give you all a quick overview of what the coalition has been working on since we last met as a full coalition back in December. As many of you know, we've been working pretty steadily towards the development of our Community Health Improvement Plan, or our CHIP as we call it, which is essentially our collective roadmap for how we want to improve community health outcomes and advance equity in the county. And so this plan follows a framework that I like to say is collaborative, it's community-driven, as well as data-informed, and it really helps us to focus all of our collective efforts on the health challenges that matter most to our residents, while also helping us align our partnerships around shared strategies for the long term. And by the long term, our CHIP usually is a 3-year process. But before we could even begin developing those strategies, we first needed to understand what health issues actually mattered most to the community. And so we relied on our community health assessment, or the CHA, which was published this past June. And that assessment helped us to better understand what's happening across the county. So everything from health outcomes to the conditions that people were living in, and the everyday factors that influence our health. And so out of that assessment came 5 priority health areas that were identified, which include maternal and infant health. We have behavioral health, chronic disease, access to care, and the social determinants of health. And we are using those 5 priorities to guide our strategy development and our action planning for the CHIP. Now, since we last met, there have definitely been a lot of moving pieces in this process, but I do have to say the coalition, you all have done an amazing job helping to lay the groundwork for strategy development and action planning. And I just can't thank you enough for your collaborative efforts. For example, we most recently realigned and rebranded our work groups so that they better match the priority health areas that came out of the CHA. And this also helped to create a structure that I think is a bit more cohesive and aligned, which I think you'll see as some of our co-chairs report out in a little bit. And then as part of the work group transition, we also launched a new work group in February called Healthy Start. And this work group focuses on maternal and infant health initiatives, specifically ensuring that our families have equitable access to the care, to the resources, to the programs that we say better support healthy pregnancies, healthy births, as well as a stronger start to life. And then we got into what I like to call the meat and potatoes of this process, because everything is about food in my world. But we are now getting into the action planning. And so over the past few months, our work groups have done everything from reviewing data, identifying problem statements, discussing root causes. They've been narrowing in on where they want to focus their efforts, and then most recently, goal setting. And so we've really used this past quarter to break this process down step by step. And that is with the idea of, we wanted to begin more broadly and then gradually narrow our focus until we land on very clear, very actionable, and equity-centered strategies that we can use over the next 3 years. And so that's where we are right now in this process. We recognized early on that there are many ways that we can address a given problem statement, right? But instead of trying to tackle everything at once, we decided to focus on identifying a strong starting point, something that I say felt urgent but feasible and also aligned with some of the current efforts that are already happening across the county. And so rather than jumping straight into programs and solutions, we took a step back. We used some divergent thinking, and we basically gave ourselves some space to brainstorm and ask questions like, what could success look like? If we were to go a specific route, who would benefit from that? How would they benefit from that? Who's missing from the table? Asking questions like, what other alternative approaches should we consider, right? So we wanted to start more broadly to give us more room to, I would say, design goals that were a bit more ambitious, a bit more inclusive, and a little bit more innovative. And so with those problem statements and with the data and with the starting points in mind, each work group was asked a simple question. And that question was, what would success look like 3 years from now? Success for individual members of the community, success for families, success for communities as a whole. And from there, we pulled together those common themes from those discussions, and we used those themes to begin drafting goals, kind of loosely drafting those goals. And as we drafted those goals, we used the presented goal setting formula as a guide. So essentially, we want to either increase, improve, or reduce what for who, by how much or in what way, by when. And while doing that, we also wanted to, keep equity kind of centered in our mind, keeping that central in all of our planning and our thinking. And we wanted to make sure that our goals and objectives reflected coordination across partners and not just duplication of efforts. And so as you can see, our amazing work groups have really been leaning into this process and quite literally chipping away at the work. You see what I did there, chip, because it's our chip. So they've been chipping away at the work. Thank you for laughing with me. I am a sucker for a good dad joke. And so I do just want to take this opportunity to have our work group co-chairs to share a little bit about the group's discussions and some of the common themes that came out of those goal setting processes. So I think we will start with our Healthy Minds work group. In the co-chairs for our Healthy Minds work group, we have Margaret Fowler and Carlos McCall from Totally Lincoln Care in Maryland, and then our health department rep, Ms. Nina Ward, who works in the Behavioral Health Services Division. And I think today Margaret will be sharing with us. So Margaret?
Thank you, Shanae. Good evening, everyone. And I just want to say I hope everyone was able to go outside and enjoy this beautiful weather. It is absolutely gorgeous out there. But I also wanted to share with you what the Healthy Minds Work Group had been really working together and having Shanae and AJ come up with some really diversion thinking, thinking outside of the box. We were able to brainstorm, and as you can see here, sort of like we looked at the problem statement. As you can see, the rates of depression, anxiety, and substance use are rising among county residents, especially the youth and the young adults. So we really focused there and talked about that. And then we went to developing where is our starting point and what does that look like? And we sort of went over that, and then we looked at the root cause of what that may be like. And so the evidence that we found here is that mental health concerns are rising in Prince George's County, with nearly half of the residents reporting poor mental health days and months and increasing frequency of distress, underscoring the urgent need for prevention and early intervention and expanding to access mental health services. And what we did is we said, Shanae had said, we said, what would success look like for individuals and families and the community. So we had this really massive brainstorming, and once it started, it was just all over the place. And poor HA and Shanae couldn't keep up with all of the things that were going on. But we selected the starting point about with the workforce capacity and support. So strengthening availability and diversity of the behavioral health workforce. And then what does that look like? And so this went on, and it was just like popcorn. And when somebody would say something, somebody would say, yeah, and then they'd put hands up. But what we came out of with all of that, it was a very engaging conversation with a lot of the members on the work team. And these were some of the common themes that came out of it was care coordination, collaboration, and then workforce support and employee well-being. And I think we're going to start seeing a lot of things that are, they were overlapping even when we were looking and reviewing information in the CHA, and was like, so it was really, we tried to pick out like what would be the best, but there were a lot of things that were overlapping. And then from that, we basically went on to goal setting. And so I don't know that we don't want me to read any of the goal setting that have come out so far, right, Shanae?
Not yet. We're still finalizing those.
Okay. So in essence, we worked very hard, and it was a very fun and collaborative effort, and a lot of thought went into all of these processes and the goals that will be presented later. I think it will see where all of this hard work and creativity, and how do we blend and braid all kinds of things that we need to have a very robust behavioral health system. Anybody have any questions?
Great. Hearing none. If any questions come to mind, you can go ahead and drop them in the chat, and we'll address them a little later in the meeting. Thank you, Margaret.
You're welcome.
All right, moving on to the Healthy Connections Work Group. We have three amazing co-chairs, Dr. Carter, who's with the Kennedy Krieger Institute, and then we have Ms. Tornisha Stokes and Ms. Caitlin Murphy, who are with the Health and Wellness Division at Prince George's County Health Department. Tornisha?
Hello, everyone. So yes, the Healthy Connections Work Group, which was CCT, the Community Care Coordination Team, we are focusing on access to care. Actually, there was several problem statements that we identified at first. There was three, and then we really drilled down and voted to see which one was the most important. Or all of them is important, but what would be our first one to drill down into? So we started with the problem statement. And actually, I'll just share the first three that we was focusing on, and then we drill down to number one. So one of them was transportation barriers, like limit to residents' ability to attend medical appointments or access specialty care. So that was discussed, and that theme was brought up several times throughout our meeting. Also, language and culture barriers contribute to low utilization of preventive care among English-speaking residents. But as we drill down and begin to vote and put the three options up for the work group or the team to vote on, we decided that we will start with the problem statement, which really focused on health literacy challenges, making it difficult for residents to navigate available services and resources. And throughout our last couple of years, we was focusing on, we even brought in different community resource inventories, companies or platforms to be demonstrated during our work group from 211 to Find Help. And so this was a common theme, and this also aligns with some of the evidence that was presented in the CHI. And so moving on to the evidence, what we drilled down and decided to really focus on and start looking at our starting points as well. So the evidence leads to limited health literacy combined with insurance gaps and barriers to care such as appointment availability, provider shortage and making it increasingly difficult for Prince George's County residents to access and navigate essential health services and resources. And we heard that throughout various meetings that we held over the last, year or so. Okay, and so also we worked on the 5 whys exercise during one of our work group meetings. And so there were several themes and ideas that the team had mentioned during out those sessions. And I can share some of those. The common themes includes like navigation and care coordination, which really focus on improving how residents move across health, behavioral health, and social services systems. We also discussed digital access and alternatives, which includes the technology, also human-centered options. We discussed provider communications and capacity, which support providers in delivering clear, coordinated, and health literacy care, focusing on health literacy and care. Also, early and community-based health literacy. So, build navigation skills before residents, each points of crisis. And so, this was like working towards phase 2 to move towards phase 3. And now we decided that our starting point, based on moving from the root cause analysis to coordinate in the action and really focusing on the starting point. So, we decided to start with the clear, centralized health information, ensuring that residents can easily find and understand information about services and benefits. And so what does success looks like in 3 years? So again, the common themes that was mentioned was centralization, accessible, clear, and consistent health information, navigation support, community involvement. So we hear that the residents, they didn't know there are so many programs that's offered in the services, having access to that information, and really having clear and concise and consistent information, and having that navigation to help like get connected to those resources, while it addresses social determinants of health barriers, getting enrolled into evidence-based lifestyle programs, getting access to behavioral health, services as well. So this is where we want to move, in regards to goal setting, and we're really trying to connect patients to the social determinants of health resources, either healthcare services.
Thank you, Tarnisha.
Welcome. Any questions?
Okay, hearing none, we'll move on. We see some virtual hand claps, so that's awesome. Thank you again. And again, if you have any questions, you can put them in the chat for us. All right, moving on to our healthy living work group, which was previously our healthy eating active living work group. We have 2 amazing co-chairs, Devin Hardesty from the Department of Parks and Recreation and Ms. Jessica Moyes from the American Heart Association. And I think our ladies are tag teaming today.
Sure. Thank you, everybody, and good evening. So with our new and improved problem statement with the Healthy Living work group, we're seeing that across the county, preventative care utilization, so things like routine screenings and wellness visits remain lower than we would like to see. So as a result, many chronic conditions are being identified later, which increases the likelihood of more serious health complications and hospitalization. So that's why we really thought it was very important that we address this. Working coming from the background of American Heart Association, we know that if we can do preventative care, which things as cardiovascular disease and other chronic diseases, then we know that when it comes to secondary and prevention, we can alleviate a lot of the symptoms and the risk factors that are associated with a lot of the chronic diseases. So we thought this was very important for us to have as our main problem statement. And then when it comes to community feedback from the evidence, and help reinforce this issue. So Prince George's County residents consistently highlighting the importance of earlier screening, stronger prevention and maintenance programs, and improving access, obviously, to healthy foods and safe spaces for physical activity. We know that everyone has the ability to have gym memberships and some of these other boutique memberships. So we know that, just getting out there, especially on days like today, we were talking about the great weather. We would love to say, or, hey, let's get everybody walking, but we know not everyone has the opportunity to get out there and feel safe while doing those types of physical activities outside by just walking around their block. So we know that safe spaces for us to be able to do physical activity is very important for the county residents. So I'm gonna now, unless anybody has any questions, I'm actually gonna transition to Devin. So who's gonna walk us through the Healthy Living Work Group's goal setting and what success would look like over the next 3 years.
All right, thank you, Jessica. Yep, as Jessica mentioned, as a group, we met and talked about how we wanted to address our goals. And from that conversation, a few key themes stood out. One area that we wanted to identify to focus on initially as our starting point is what you see here, built environment and healthy living supports, which will strengthen access to healthy foods, safe physical activities, and prevention supported environments. And as Shanae mentioned earlier, in our meeting, we also talked about the question, what does success look like in 3 years? And this is where we had a great discussion and identified our common themes, which are community engagement, early detection, improved access to care, enhancing clear, consistent health education and messaging across partners, and intentional coordination efforts across partners. So yeah, that's a little bit about what we talked about in our group this past meeting.
Thank you, ladies. Any questions? Hearing none, we will move on to our last work group. And I do want to preface that Healthy Start did just launch in February, so we're about a month behind. But Dr. Cooper is going to come and share about the problem statement, about some of the data, and share some other key points. And I'm going to go ahead and now turn it over to Dr. Cooper from the University of Maryland.
Good evening, everyone. Is everyone able to hear me okay? Great.
Yes, ma'am.
Okay, wonderful. Well, I'm going to start off with our problem statement. And as we know, our issue that we have is many pregnant women lack consistent in early prenatal and postpartum care. And we're particularly looking at vulnerable populations, such as those receiving Medicaid or without or little insurance. As far as the evidence related to the CHI, since 2013, we see the county has a higher percentage of births with late or no prenatal care compared to the others within the state. This is 11%, over 11% of births in 2022 receiving late or no care versus 7.5% in the state. So another area that we are, looking at as far as evidence would be maternal and mortality rates. And when we look at the maternal mortality rates, we still remain higher than the Maryland average. And the percentage of low birth weight as far as infants has exceeded the state rate since 2013. Now, when we look at what's going on a national scale, we know that the United States, although those numbers related to maternal and child deaths have declined since 2018, we still have a problem. And we need to address those particular problems by looking at not only the root causes and underlying issues, but what is going on systemically. And that's the beauty of this group, because we look at quite a few of these things are interwoven as far as continuity and coordination of care, behavioral health. And this is why I love the direction that's being taken now with this particular work group. The other area that we want to take a look at is we, like prefaced by Shanae, we have not met as frequently as the other groups, but we're going to be taking a strong stand because we have committed individuals who have met with us in the previous month. And we're going to also look at a strategic approach that's going to leverage those resources within the community so that we can better address those particular shortcomings and bridge those gaps in services. As far as engaging in goal setting, the group will, just like the previous groups, will work diligently to define what success looks like, leveraging resources, and looking at this in 3 years and identifying common themes for the discussion. And we're going to also, the beauty again, is do this through the lens of not only the committee members, but those who are active within the community. So we're going to be looking at emerging ideas, sharing priorities to inform and draft goals and to bring about best practices. On another note, we're also looking for a co-chair. So if you do have an interest in strong engagement, bold conversations, and bringing about actionable steps to address these particular challenges that exist within the county, please feel free to reach out to Shanae. We welcome anyone who would want to be a part of our committee and making a difference and having an impact in the community. Are there any questions I can answer at this particular time? Hello?
I don't hear any questions.
No questions. Okay, my screen blacked out for a little bit there. So my apologies.
No, you're fine. Thank you, Dr. Cooper. We appreciate you for sharing. So yes, I do just want to echo Dr. Cooper's sentiment. We had our first meeting last month, great participation. I think there was wonderful energy in our virtual room. And I think we had some great expertise there, some great experience in the room. And we're all just willing to work together, to come together to make a difference in this area as it pertains to maternal and infant health. And yes, to echo again, we are looking for a second co-chair. So if you are interested, please feel free to email me directly, or you can email the PGHAC email as well, and I'll get that too. But thank you all so much for sharing.
Shanae, I'm sorry to we do meet once a month, and it's the third Thursday of each month from 11 a.m. to 12 p.m.
Wonderful. Thank you, Dr. Cooper. Teamwork. I love it. Thank you so much. Any questions for any of the work groups, anything they've shared? Any thoughts or comments? I'd be interested in hearing just general comments or thoughts from the group that's with us today. You think we're all heading in the right direction? Should we be considering other alternatives? I see some thumbs up. Another thumbs up. Oh, lots of thumbs up. Oh, wonderful. And hearts. I love it. Okay, great. Well, that's good feedback. And yes, as always, my email room is always open. So please feel free to send me an email. We can set up a Teams call if you'd like. To discuss further. If you have additional ideas you'd like to share that you're just not ready to talk about in front of everyone, that's okay too. I'm always open to hearing different perspectives, to learning about the different resources that exist in the county, because we do want to make sure we're considering everything and everyone, again, keeping equity central in all that we do. So if there's anything or anyone that we feel is missing from the table, again, my food analogy, I want to make sure everybody's eating. So there's plenty of space at the table for everyone. We don't want to miss anyone. If anybody was at our work group meetings last month, we talked about the pasta. So we're cooking enough food for everybody, for as many people as we can. So feel free to, again, send me an email. We can set up a call to discuss further. And we welcome you to attend our work group meetings, hint, hint, if you'd like to contribute as well. So thank you all so much. And thank you to our co-chairs for your leadership. All right, moving on. Want to chip in? Ha, 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 ha. Again, I do just want to thank our co-chairs again, just for your leadership, and thank you all, our work group members, again, for just leaning into this process over the past few months and being patient with me as we just really break it down piece by piece. I really do think that this CHIP it is the community's plan of action, and it should be reflective of that. And I know that we can't do this work without you all. So I'm just incredibly grateful for just all the experience, the expertise, all of the insight, and just everyone's openness that you all are bringing to the table. And so, we're moving into this next quarter. And so we'll be taking the next big step, which is moving from our goals to our strategy development. And this is where we really start to figure out how we want to operationalize the goals and the objectives that we've identified together. So for those of you who would like to chip in, I do want to briefly share what's coming up next and how you can continue to be involved with our coalition. So as you've heard, our co-chairs shared some of those common themes that have come out of our work group discussions. And so we are in the process of drafting those goals and objectives, which will be shared at our March meeting. And so the work groups will spend the next couple of months really determining how we want to prioritize those goals and objectives, which goals and objectives we think are most feasible, most actionable, and then we'll begin the process of really starting to develop those specific strategies for implementation. So in other words, we're going to start considering questions, again, like what specific strategies or activities do we want to consider when we're trying to essentially turn those community priorities into clear coordinated action. We'll start answering the question, how do we line our partnership around shared priorities? How do we focus our resources where they matter most? And also consider, how do we maintain sustainability? Because we don't want to just come in, do an activity and leave, right? We want to make sure we're ensuring sustainability. We're building that community trust. And not only that, but holding ourselves accountable to the work that we say we're going to do, right? We're all passionate about making a difference in the community. And so we want to make sure there's proof behind that passion. So we want to make sure we hold ourselves accountable to this work. And while all of that is happening, our coalition team will be working behind the scenes to draft the CHIP document itself. And so with that, we'll kind of go piece by piece and we'll work closely with our partners, with our community members, with our steering committee to gather feedback for the various portions of the CHIP document as we draft that and go through that process. Because ultimately, our goal is to develop a plan that not only aligns with the community health assessment data, but also reflects the voices and the perspectives of our community partners, and those who serve Prince George's County as well. So a lot of moving pieces, as I mentioned before, but we're getting it done. And I'm really, really proud of what we've been doing so far. And then June and July come, which it's crazy to say, but it's really not that far away. So towards the end of our fiscal year, we will start to present those action plans. We'll present them at the next quarterly meeting in June. We'll open the floor for final feedback because we want to make sure that we can finalize this CHIP document and then prepare for publication and countywide distribution. Because we want to make sure that we have county buy-in from county leadership, from senior leadership at the health department, from all of our partners, from community members, because I think that is what's going to make this an effective plan. Remember, our goal is to have this plan completed by the end of July. I am fully confident we can do it. But again, we can't do it without all of you. I've said before that this CHIP isn't just a document. It really is just a collective commitment to finding ways to improve the health and well-being of all of those in Prince George's County. So again, if you haven't heard me say it enough already, I will say it again. Thank you, thank you, thank you in advance for just your continued support and engagement. I haven't been here long, but we have done a lot of work in these last 7 to 8 months that I've been here. And it's because of you all that helps move us from this planning to action and ultimately helps us create lasting impact in our community. So you'll be sick of me saying thank you, but just know how much I mean it. So if you are interested in contributing further to this process, we do, of course, invite you to attend any or all of our upcoming work group meetings if you're looking for something to do. And on this slide, I've provided just a quick snapshot of the meetings that are coming up in this next quarter, so starting in April. And yes, again, we welcome you all to participate, especially during this CHIP planning phase, because I want to hear your expertise. We need your support for this action planning process because this, I think, is the most important part of this CHIP document. So I'll leave this up for a couple of seconds if anybody wants to take a picture, but I will make sure these slides get sent out so you have this for your record as well. Any questions on next steps or how you can get a little more involved? And invite your friends, invite your colleagues. The more the merrier. It's a party. All right. Well, hearing none. With that, before we jump into community announcements and wrap up early for the evening, again, we just want to say thank you as always for your partnership, your insight, and commitment to this work. I'll open the floor for any last questions or comments before I turn it over to AJ. With that, AJ, I'll give you a few minutes to highlight some community announcements and upcoming opportunities. We only have a few to share with you all, just countywide announcements. And, as you come to the work group meetings, we share more specific partner announcements. But again, these are really just great ways to stay connected, to share resources, to support one another's work. And as always, we'll be sure to share these slides out after the meeting so you can have these for reference. But if anything comes up in the meantime, if there's any announcement or anything going on in the county that you all want additional support or would like us to share out, you can always share those announcements with me, and I'm happy to extend those out to our partners. So with that, I'll go ahead and turn it over to AJ.
Thank you, Shanae, and thank you all for attending today. We did cover quite a bit. I did want to give another special shout out and thank Olo again for all the help and support that he's offered to the coalition. And we truly appreciate everyone's contributions, and we also wish you very best in your next chapter, Olo. But thank you again for that. So first, we want to highlight an upcoming event from the Domestic Violence and Human Trafficking Division. They're bringing back the Momentum Conference for 2026. And this year's theme is Men Strengthening the Way for Youth to Lead the Change. This event will take place Saturday, March 14th from 8 a.m. to 1:30 p.m. at Central High School in Capitol Heights. Students will have the opportunity to participate in breakout sessions covering teen dating, violence, mental health, and safe encounters with law enforcement. Service learning hours will be provided, and breakfast and lunch will also be available, along with raffles, giveaways, and resource tables. So if you work with youth or youth serving organizations, please consider sharing this opportunity across your networks and encouraging students to register. Another event we wanted to share is the 48th Annual Valor Awards Luncheon. It's going to be hosted by the Prince George's County Public Safety Assistance Program. This event recognizes public safety officials who go above and beyond their duties to help keep Prince George's County's residents safe. This luncheon will take place on Wednesday, April 15th at Martin's Crosswinds in Greenbelt. Doors open at 10:30 and the program will begin at 11 a.m. Sorry, tickets are $50 per person. Sorry about that, and $500 for a table. My apologies. Another opportunity we wanted to lift up comes from Maryland Wellness, who asked us to share information about the upcoming Swell Conference. So this is a multi-day professional learning and multi-day professional learning and wellness experience that includes presentations, panel discussions, as well as practical tools that participants can apply in their professional settings. This conference will take place April 16th through the 18th in Ocean City, Maryland. And if you're interested in learning more or registering, you can visit their website using the link on the slide. And one more event we wanted to highlight is the GOAT, G-O-A-T, Youth Mental Health Expo, which will take place Saturday, May 10th at Bowie State University. This is a free event for youth ages 16 to 25 and their families, and it will include workshops, resources, live performances, and connections to mental health supports. So again, if you do work with youth and families, we'd appreciate your help spreading the word and sharing the registration link with your networks. Thank you for dropping those links. And with that, I'll pause there and see if there are any additional partner announcements that anyone would like to share.
Taylor, are you on the call by chance? or anyone from the health and maybe Tarnisha. I know you all have a lot of programs going on. Are there any programs that you could use additional support in recruiting or anything like that for community participation?
Yes, our chronic disease program is launching a Healthy Heart Ambassador program, and it's anyone that's 18 and older that's been diagnosed with hypertension or high blood pressure. The open enrollment happens actually this week, starting tomorrow at Prince George's County Health Department headquarters in Capitol Heights. I don't have the flyer right now. I'll give it to you today so you can share. And then also we have an our Dine and Learn event in partnership with Suburban Hospital. And I don't have that flyer on me right now, but I will make sure I'll get that to you as well so you can share with the coalition.
Great, thank you.
Thank
And
you.
Nina, I think I saw your hand.
Yes, hi everyone. I wanted to share the Bridge Center at Adams House, which functions as Prince George's County's reentry center, will have its first annual, I don't know if you can call it first annual yet, but its first annual open house on March 27th. It's a Friday, end of the month, to kick off Second Chance Month, which is April. So we will have an open house just for everyone to come and see what we do at the Bridge Center, meet some of our partners and service providers. So I have a flyer. I will share it after this meeting, and Shanae or AJ hopefully can be shared with everyone here. But welcome anyone and everyone to come. Also, please share any prospective clients, current clients, alumni clients, and then stakeholders, family members. We'd really like to see everyone.
Thank you, Nina. And Jessica,
And
do you care to share a bit about, oh, I'm sorry.
yes,
Did
and I totally forgot, and forgive me, Devin. We always partner with Park and Planning, so they're also a part of in partnership with the health department in Suburban for the Dine and Learn as well. So please forgive me.
Thank you. Jessica, do you want to share about the CPR policy and kits?
Sure. So I sent it over to you,
Perfect.
Shanae, for you to, like, if you want to distribute to the group. But yeah, so American Heart Association CPR readiness and CPR policy is kind of one of our priorities. So we're trying to see what if organizations, like we've already spoken some to Prince George's County Parks and Planning, and to see organizations that are interested in implementation of if they don't already have one as part of their emergency plan. A lot of organizations already have emergencies plans, but they don't always have a cardiac plan or a CPR policy in place in case an emergency happens. So we're working with organizations throughout Greater Washington region to implement that. And with that, also providing CPR anytime kits for teaching in the community, for community members and for the staff of the organizations to continue as practice and to learn. So provided a PowerPoint to go out to the rest of the collaboration, and then just to contact me if you're interested, and we'll definitely work alongside you to get that done.
Awesome. Thank you.
Mhm.
These are great announcements. Any others? There's so much happening in our county. Olo, Jake, anything happening at the health department, like senior level, the health department?
Oh, well, there's always stuff happening. Like, one
Loaded
of the things
question.
worth noting, we are, in the very, very end stage of finishing our strategic plan. So we're right about to, we're close to release. We had a new health officer, and, she's having her, final review of that. But we're hoping to have the final, draft of the strategic plan out, very, very soon. So there is that. We also have a new chief of health policy and innovation. That position was previously held by Stephanie Little, who left to take another great position within the community, and particularly in mental health. We now have a new person who is named as Andrew Ballard, He's a doctorate in performance management and health and policy. So he's going to be, fulfilling that role internally. So we're really trying to fill the ranks of the health department and moving our mission forward.
Thank you.
Yeah.
Before we move on, any other announcements? And again, if anything comes to mind later, just you can send it to me via email, and I'll have it included in the follow-up email tomorrow. All right, hearing none. I'm sure this looks familiar to many of you. If you have not done so already, please scan the QR code. The link will be available as well to update your contact information for our coalition directory. Some partners, as we know, have transitioned to other parties. And again, we've had some new ones join us. So I do want to make sure that we are maintaining an accurate and up-to-date record of our coalition participation. We will also make sure to utilize this directory as a way to ensure we are giving proper credit to those who are participating in our CHIP development process. We do want to make sure we acknowledge those who have assisted us in this in the completion of this process and of this plan. So please make sure that you fill out this directory and your contact information. I'll give it a 5 seconds for those who are scanning. All right. And with that, 7 o'clock on the dot. Look at that. Thank you again for joining us today. I know we're ending a bit early. You're welcome. Enjoy some dinner. Enjoy the weather. We look forward to seeing you all at our upcoming work group meetings because we will see you all there. And we look forward to seeing you all at our upcoming in-person June quarterly meeting as well. So have a great evening. There's a little bit of sunshine left, so go out and get a walk and enjoy the rest of this day and the warm weather. Thank you all so much for being here. We appreciate you.
Thank you.
Thank you.
Bye-bye.
Bye.